Hello, and thank you for watching. Strongteeth4 Life is a YouTube channel, and it's made by me, a British qualified dentist of 20 years, to help you have healthy teeth and gums. It's a free and open source, it's non-profit, non-commercial. So we are making videos on the prevention of gum disease. This first video has 3 parts: how gum disease can affect you, what is gum disease, and testing for gum disease in your mouth. How gum disease can affect you. Gum disease can affect you starting with bleeding gums, bad breath. More gum disease means loose, ugly teeth and teeth falling out. So you need expensive dental treatment. And you may need to wear false teeth or dentures. Gum disease can be very serious. So what is gum disease? Well, if we start with normal gums, when we look inside our mouth, this is what we see. You see your teeth and you see pink healthy gums. So we can use a model to show you what normal gums are. So if we first start with a tooth, which is over here, and then you have the model of the jawbone. And so the teeth, they sit in the jawbone like so. And the tooth is firmly gripped by the jawbone, not coming out. And with healthy bone, jawbone, it's all the way to the neck of the teeth, over there and there. Then what we have is the gum skin. And this covers the bone, like so. So when you look in your mouth, this is a representation of what you see. So for gum health, we always look at 2 things in your mouth. We look at the health of your gum skin, and we look at the health of your gum bone. There are 2 stages to gum disease. The first stage is where the gum skin becomes red and bleeding. So what does this mean with our models? So what will happen is you go from a nice healthy pink gum and you go to a red gum skin, which is bleeding. But the bone underneath is still very strong. So when you look in your mouth, it goes from healthy gums like this to stage 1 of gum disease with red bleeding gums like this. So gum disease can progress from stage 1 of gum skin being red and inflamed to stage 2. So what's happening over here is you've got your jawbone, and instead of the bone being right up to the tooth holding it in place, what you'll find is that you start to get some bone being lost. And if this progresses, then you get severe bone loss over here. And with severe bone loss, the teeth can become loose. So this is stage 2. Now, you feel no pain with stage 2 as the bone's being lost in your mouth. So you may actually have gum problems even though your teeth look okay and you don't feel any problems. It's only when you get to this stage of severe bone loss that you get problems. Now, why is that serious? Because once this bone has been lost, it doesn't come back. And then you may ask another question, why can't I see this bone loss in my mouth? And the answer is, you've got this gum skin that's covering it. So it's hiding the bone loss that's occurring. And you cannot see the bone damage as it's occurring. Because the bone is covered by the gum skin. So when you look in your mouth, it goes from stage 1 of gums bleeding, like this, to stage 2 of gums bleeding and the bone loss underneath the gum. But this is hidden, the bone loss. So when you look in your mouth in stage 2, it looks just the same as stage 1. So as a summary, healthy gums have pink, healthy, firm gum skin that does not bleed with strong bone underneath. Stage 1 is the gum skin is bleeding, red, but has healthy, strong bone underneath. Stage 2 is where you have bone loss, where the gum skin is red, bleeding, and there is bone loss around the teeth. This goes from some bone loss and can progress to severe bone loss. So, how do you know if you have gum disease? Well, when you go to your dentist, there are tests they do to check for gum disease. The first test for gum disease is a BPE gum score. The dentist uses a BPE probe in your mouth to test the gums. And this is the probe. So if you have healthy gums, pink healthy gum skin, strong bone underneath, then you get a BPE gum score of 0. If you have stage 1 of gum disease where the gum skin is red and bleeding, but the bone underneath is still strong and healthy, then you get a BPE gum score of 1. If you have stage 2 of gum disease, where you have red, bleeding gum skin, and you have some bone loss, then that's a BPE gum score of 3. And if you have severe bone loss, like so, then you have a BPE score, gum score of 4. The second test for gum disease is using X-ray radiographs. So if we look at healthy gums and we look at the bone underneath, like so, and we take a X-ray, then what the X-ray does is it's showing you a picture of your bone levels around your teeth. So if you look at the teeth over here, they're in your jawbone and the bone levels are around the necks of the teeth. Great. So when the dentist takes an X-ray, it's showing the same thing over here. When you've got healthy gums and bones, then that's your teeth, and that around it is your bone level. So that's what you're going to see with X-rays, and that's why a dentist takes this X-ray as a test. Now, when you have stage 1 of gum disease, where the gum skin is red and bleeding, but the bone underneath is healthy, then when the dentist takes the X-rays, which shows the section of your teeth over here, again, you're going to see normal bone levels. So there's no bone loss. So your bone's fine. So when you have stage 2 of gum disease, where you have the gum skin being red and bleeding, and also you have some bone loss, and you have, if it progresses, severe bone loss, then again, when they take X-rays, they're looking for the insides of your teeth. Now, what they're going to find when they take the X-rays is if you've had some bone loss, then that's what the X-rays are going to show. It's not right to the neck of the teeth there, the bone levels, they just had some loss over there. So if you go to severe bone loss, then what you'll find is that the bone levels are just here. Instead of being at the neck of the teeth, the bone level is going to be down here near the ends of the roots. And as you can see, that's when these teeth become loose and they start falling out. And that's what it's showing you, where the bone levels are here near the ends of the roots as opposed to near the crowns or the neck of the teeth over here. Stages of gum disease and test results. When you have healthy gums with gum skin being normal and no bone loss, then the test results are a BPE gum score of 0 and X-rays showing normal levels of bone. Stage 1 of gum disease, where the gum skin is red bleeding with no bone loss, then that shows normal X-rays with normal levels of bone, but a BPE score of 1. The next stage of gum disease, stage 2, is where you have bone loss, where the gum skin is bleeding and red with some bone loss, or you can have severe bone loss. With some bone loss, The X-rays show the bone levels have been reduced and the BPE gum score is 3. With severe bone loss, the X-rays show more bone loss around the teeth and a BPE gum score of 4. The reason I am explaining these dental tests for gum disease is not to train you to become dentists, but so you have more awareness and understanding of your gum condition, so you are more involved in improving your gums. The main point is when you next see your dentist, ask them, what is my BPE gum score and my X-ray bone levels where appropriate. Stages of gum disease and long-term effects. We start with healthy gums. If you go to stage 1 of gum disease, where your gum skin is red and bleeding, don't wait until it reaches the next stage of bone loss. If you take action now, you can reverse gum disease and return back to healthy gums without any long-term damage. If, however, gum disease progresses to stage 2, where you have bone loss, where you have some bone loss, this is actually very common and occurs in 50% of the population in Britain. Most bone remains, so all is not lost. If you take action now, you can avoid the next stage of serious bone loss and you can keep your teeth throughout life. If bone loss progresses, so you have severe bone loss, this is very rare and only occurs in 5% of the population. Most bone is lost, so the teeth can fall out, and this is serious. Remember, once bone is lost, it does not return. So the key message is you can help yourself right now. Good prevention can stop gum disease. 90% of gum disease is easily preventable. It is not inevitable that you will get gum disease. You can make a huge difference with good prevention and take control to have strong gums for life. So thank you for watching so far. You've seen the first video. There are 2 more videos in the series which you can find on the YouTube channel Strongteeth4 Life. I want to raise awareness on oral health, so feel free to download and share this video. Download the STL files for the 3D models in the description box. There is no copyright for personal use. Some background information on who am I and what is Strongteeth4 Life. I am a British qualified dentist of 20 years. I had serious medical problems for many years, and this gave me a patient's view of healthcare. Thankfully, I had my expert knowledge on dental prevention to save my teeth, whilst having a lot of medical care. So my aim is to share these really effective prevention methods with everyone. So Strongteeth4 Life is a free, non-commercial, non-profit YouTube education channel. And I'm trying to use the latest technology like virtual reality videos and 3D printed models. So what's the big issue at the moment with dental health when you go and see your dentist in the UK? Well, you see a dentist because you might have a problem, for example, bleeding gums, or you go to the dentist to check how good your gums are. Do you have gum disease? It's all about disease and treatment. So the question is, how many dentists explain detailed prevention in your mouth? Not as many, because dentists have not been given the time for prevention. So that is why Strong Teeth for Life is important. People have serious dental problems, and I don't want you to feel that you are past saving. Prevention can help stop these problems. So also you can ask your dentist to show you better prevention in detail in your mouth and to improve your prevention before any gum disease starts. For oral health educators, there are some free resources I found, some from this channel and also from other places and other tools.